Blood was a bit unnerving and unbearable, and so was death, particularly the death of children.
My full names are Shahin Sayed Mohammed, and I am a pathologist. Specifically, I'm an anatomical pathologist. I'm based here at the Aga Khan University Hospital Department of Pathology.
My name is Dr. Mercy Korir, and on this episode of Doctor's Diary, we bring you the story of Dr. Shahin Sayed. She is the chair of the Department of Pathology at the Aga Khan University Hospital in Nairobi and has been practicing pathology for the last over 15 years.
I mean, it's all about, in a way, we are sort of behind the scenes normally, and it's a way, it's the way, if you look at media, if you look at TV drama series and soap series, it's all about the forensic pathologist because it's sensational, it's exciting, you know. So that gets sort of more like CSI, gets more press than somebody who's got fibroids. I mean, really? So if you know what I mean. So that I think it's just that unfortunate sort of misperception about pathology.
Pathology was nowhere near Dr. Shahin's radar while growing up. She saw herself being any other doctor, not a pathologist.
There were two sort of defining moments in my life. One was, when I was growing up, I always knew I wanted to be a doctor because I had a sick mother who was in and out of hospital. And I felt I had to do something, and I had to, help people who are in that similar position. So I always knew that. But then from the community, I come from a very small conservative community, was born in Mombasa, so very small and conservative. And so at that time, becoming an OBGYN was like, the in thing. So you are a female, you need to help the women in the community, so become an gynecologist. So when I went to med school, I thought, yes, that's what I want to specialize in. But then I realized I could not, it was just too much. When you do your student rotations, I knew when I went into theater, I could not, there was so much blood all the time, and it was too gory for me. And I no, this is not my cup of tea. So I knew then I couldn't and wouldn't do OBGYN, much to the disappointment of my parents. And then during my internship, I was rotating in pediatrics at Kenyatta Hospital, and I loved it. I really loved pediatrics. I thought, that's what I'm going to be. I'm going to be a pediatrician. And one of the patients, a small 5-year-old with a nephroblastoma, which is a kidney tumor, I was in that ward, and she was going to be taken into surgery. And I remember preparing her for the surgery, getting everything ready, because that was part of what I was supposed to do as an intern. And I got very close to the baby. She was just about 5 years old. And then I went on leave, and when I came back, I didn't find her there. So I was like, what happened? Where is she? Where is so-and-so? And I was told, oh, you didn't, I'm so sorry, but she didn't make it. Oh, that was it. I think I went into depression. For a whole 2 weeks, I couldn't think, and I said, no, this is just too much. I cannot handle this. I'll not be able to. I need to be away from the patient, facing profession, and this is just too much. And so a friend of mine, a colleague of mine, was doing pathology at that time, and I'd always be running up and down from the wards to the pathology department, looking for this result and that result. We can't discharge this patient, waiting, is it cancer, is it not? We can't discharge this patient because some lab results, maybe some hematology results are pending. We need to know before we discharge. And I thought, wow, everything. is so dependent. Every decision we make as doctors is so dependent on the pathology department, right? So it started there, and this colleague of mine said, you know what? You need to come into pathology. You'll never regret it. Think about it. We need pathology for everything. You're coming to me all the time. And I thought, I think that's what I need. That's what I want to do. I cannot take the gore and the pain and the death, that, because you tend to grow very close to patients. And that's when I opted for pathology. I haven't looked back since. Never regretted it. Mm-hmm.
The training in pathology,
right.
You say you fear the gory, the death, but in pathology, the training you have to go through,
right.
basically face death. Isn't that something that would sort of scare you, for lack of a better word?
Right, I know a lot of people, everyone said pathology, but you're going to be in the autopsy room, and how can you even... But at some point you sort of get dissociated from that. And the other thing that drives you is like, if a patient has passed away and shouldn't have, right? You need to understand why, so that you can help others. So, for example, there was a study I recall when I was in Kenyatta many years back, and I was just, helping out the primary investigator, doing the study. And they were looking at the causes of patients dying in the wards who were thought to have, respiratory illnesses, and they found, I think, about 40% of those cases were actually TB, and TB is curable, right? So that helps. And when you disseminate those findings and say, hey, if you have such symptoms, think TB first. Don't think of other exotic diseases. So that's how I look at it, being able to help. Even if you cannot help the patient who has passed away, you can definitely make a difference by creating that knowledge, by being able to say to physicians and alike that there are other things, common things, and common at the end of the day.
Dr. Shahin has learned to turn her obstacles into opportunities and rise to be among the best in her field.
So thankfully, I haven't faced, too many sort of challenges, being of a female gender. I've been lucky that way, I guess, but I think it's a lot to do with you have to, irrespective of whether you're a man, you're a woman, you have to work hard, right? There's no shortcut. Just because I'm a woman, there's nothing like a shortcut in life.
You find that you have to work harder?
Yes, sometimes, yes. Yes, sometimes, yes, you do feel you have to work a bit harder, extra, put in that extra effort. Maybe just to prove that you can do it. It doesn't matter that you're a female. You can do as well as your male counterparts. So yes, sometimes there is that pressure, but I guess that's just part of life throws you all sorts of curves, and you have to navigate it irrespective.
She describes pathology as a very diverse field of medicine where, as pathologists, they take care of the entire body.
We literally take care of the whole body, from the time the of conception to the time of death. So when you hear about pathologists and autopsies, that's just one aspect of what we do. And in autopsies, of course, you understand that you have medical autopsies where patients who have chronic illnesses have been admitted to hospital, then they pass away, or they pass away unexpectedly sometimes. So you need to understand what the exact cause of death was. And then there's the forensic part of that's a different aspect of pathology, where you have forensic pathologists who are trained pathologists in forensic medicine, forensic pathology, who then do post-mortems and autopsies for medical legal reasons. right? Whether it's a suicide, or determining is it a suicide or a murder aspect. So that is just a small component of pathology. Pathology, right from, like I said, from inception to the time a person dies, that's where we come in. So things like antenatal testing, right? Antenatal testing. A woman is pregnant, want to know, is this a normal baby? Is it going? What are the risks of having a Down's baby, for that matter? So that we do in pathology, and specifically we have trained clinical pathologists who handle these aspects of testing in blood samples, specifically blood samples. And then you have hematology, and again we have hematopathologists who do testing and interpretation of tests regarding, for example, your full blood count. You have an executive checkup, you do a full blood count, or you have a cancer of the blood, leukemias and the like. Then you have a hematopathologist looking at what we call their flow cytometry results. So it's very sort of varied. So that is hematology. Then you have microbiology. If you have an infection, you're admitted to hospital, you have an infection, so doctor says, well, we'll have to do a swab from your nose or from your throat, or we'll have to do your urine culture. That's where microbiologists come in, and that's still part of pathology. And then you have anatomical pathologists, people like myself who are trained to look at tissues and to look at cells and make a determination as whether these cells or these tissues are cancerous or non-cancerous. So a woman who goes in, for example, fibroids, she has uterine fibroids, and when that uterus comes out, it comes to us, and we confirm that this is what the woman has, which are uterine fibroids and nothing more. There's no malignant change. Or a woman who goes in for her annual Pap screening for cervical cancer. Those cervical cancer, the screening, the slides, the Pap smears come to us, and we look and say, yes, there is no malignant or pre-malignant condition.
For a very long time, particularly in Kenya, pathology and lab work is sort of by the way.
Mm-hmm.
When people are setting up clinics and facilities, you do all of these beds, theaters and everything, and your lab radiology is sort of like, oh, I think we also need to set up this.
Mm-hmm.
Is that still going on? Is that still the case?
I think one of the issues we've had, and it's across the continent actually, is a lack of a specialist skilled force, right? And I'm specifically talking about pathologists. We had very few in the country for the longest time, and the ones who were in country were specifically in the public sector, some private maybe, but over the years this narrative has changed. We're having a lot more. So there used to be just the one University of Nairobi pathology program where I trained. But over the years, now we have us as well taking the mantle of training pathologists. So I think the numbers have gone up, and with that has created the awareness of the importance of pathology diagnostics in care. That without diagnostics, you can do whatever you want. You can be the best of clinicians, but remember, you are just treating symptoms. You're having a syndromic approach. So you need the laboratory doctor to be able to guide your management, and that's across all the pathology disciplines, and that's across all the medical disciplines, be it pediatrics, neonatology, be it internal medicine, surgery. I think the first thing that comes to mind is being part of training the next generation of pathologists. I think that would be my proudest if I were to look back. And when I retire, and if I'm looking back, I'd say, yes, that's what I did. I was part of that whole process of training the next generation of pathologists.
what do you do differently that makes the training, for example, here different from other kinds of training
in Kenya? So we only have the other one, which is in University of Nairobi, which is in general pathology. So it's currently a 4-year program where you do 2 years of anatomical, and it's a combined program that you go through all the departments in micro, histology, cytology, chemistry. So you do the whole sort of program in 4 years. But what we have here, we have dichotomized the program. So we have a 4-year specifically in anatomic pathology and a 4-year specifically in clinical pathology. And clinical pathology covers microbiology, covers molecular pathology, covers hematology, covers clinical chemistry. So that's all clinical pathology and immunology. And then you have the anatomical pathologist training, which covers histopathology, cytology, molecular pathology, so forensic pathology. So forensic pathology is a component as well of the anatomical pathology.
Why is it separate as opposed to what Nairobi has?
So I think Nairobi has an excellent program, Nairobi University, and it's very much geared to serving peripheral hospitals, especially government facilities that require a generalist who would be able to take care and look after the whole lab, right? And whereas when we were designing this program, the thinking was it's high time we moved away and we offered something different that would then train the specialists and the subspecialists that we so much require in this part of the world, because we don't have, right? So that was the thinking that was driving this sort of separation into the two disciplines. But more and more we've realized how important it is, like even for county hospitals, government hospitals, that more and more, other than the generalist, they also need to provide or make provisions to have a anatomical pathologist and a clinical pathologist, because it's no longer viable to work in silos. You have to have a team effort. Pathology is vast, as I've explained, and so you need that ability for people in the county hospitals as well to be able to provide more specialist service, because many of these county hospitals are now are referral centers and are becoming cancer centers, for example. So you need to have these people who are generally supported as well.
And I see the regulation of let me say the laboratory work and the doctors in Kenya is sort of confusing, where the doctors like yourself are regulated by the medical council, but everything else that you do in the lab is under the laboratory technician. Doesn't this cause confusion and a bit of clashing between the different cadres?
So so that's a very good question, I must say. Yes, we are regulated under the medical council. But like I said, when this Gazette notice was passed so many years ago, remember we didn't have enough pathologists. So the pathologists did not really have a voice. We have many more laboratory technicians, technologists. And so I think the numbers carried the day. But we are trying to work. I mean, there is no reason why we cannot work together. It's just having to understand what one's role is. And if I am a pathologist, so we have issues about, okay, if I am a pathologist, I am governed by the medical council to provide a service, a clinical service, albeit it's within the lab. Why should I then be governed by the my lab, if I decided to set up a private laboratory, why should I then be governed by the Kenya Medical and Laboratory Technicians Technologies Board? And I report, and my reporting lines are to the medical council. So why? And I don't report. Of course, there has been some tension, but I think this is the time we need to sit together, across, because we are, at the end of the day, I cannot do without my technical staff. I cannot. There's no work. It's a team effort. So in terms of regulation, I think we need to just sit across a table, not have that divisive sort of attitude and say, hey, we are here to promote the best laboratory practice. Can we sit together and work together to ensure that this happens? It doesn't matter, that if you are in a regulatory board, why then can we not have pathologists be part of that inspection team that goes to inspect laboratories across the country? Yes.
As the country discusses UHC, affordable health, is pathology included in the conversations as weighty a balance as it should?
No, it is not, and that's a big gap. And so we are trying. We have been. So we have the Lancet Commission on Diagnostics. I'm a commissioner on that Lancet Commission, and we are trying to create that awareness among among leaders, especially, in LMICs. It's not just for Africa, but in LMICs in general, where pathology is like, we'll have a little lab on the side, but it's much more cost effective to invest in a laboratory, good laboratory doing quality diagnostics, and good imaging centers doing quality imaging studies, than to wait until the end and you give more expensive, maybe inappropriate treatments. I think we are trying to generate that awareness through the meetings and publications, and meeting with the government officials, and trying to be part of the conversation and saying, hey, it's high time you paid more attention to diagnostics. And I'm not talking just specifically about pathology, but as well as imaging. He says, well, it looks like you have to work so hard and for so many years to become good at what you do, and saying it's just too much effort and not commensurate, he says, pay. Okay, so so he finds no, but he's not interested in medicine at all. Yeah, he wants to do something totally different. Advocate in the sense that advocating for access to quality diagnostics for all patients, irrespective of their socioeconomic status.